One question a lot of people ask when they're trying to lose weight is, are supplements a good idea? Well, I'm going to try and answer that question in this video. Now, a few things to bear in mind. If you're not eating as much food as you usually do, then you're not going to be getting as many vitamins and minerals as you were previously. And the nutritional value of some calorie-negative foods is very low. Also, exercise may put your body under strain. With that in mind, a good multivitamin or mineral supplement can be beneficial, but be sure to check and make sure that you're not intolerant first. But what about supplements that are marketed as a direct aid to weight loss? Well, quite frankly, most of the ones on the market now are basically the 21st century descendants of this collection here. It's snake oil for the new millennium. And they are generally useless at best and harmful at worst. But there are a few that have been proven to work. And the first one is Orlistat. Now, Orlistat is available over the counter in pharmacies in the UK, the USA, Australia, and New Zealand. And it's also available as a prescription medication in some other countries. And it's often sold under the brand names Xenical or Ali. And this medication works as a fat blocker, preventing the body from absorbing a certain percentage of the fats in food. And the usual dose is 60 milligrams 3 times a day. And what this does when you take it at this amount is it blocks the absorption of around 25% of the fat eaten. And this increases to around 30% at a dose of 120 milligrams, which is not recommended without medical supervision. Beyond that, there's very little added effect, so there's no point in taking more. Of course, there are some side effects. The biggest one is bowel disturbance. Orlistat blocks the digestion of a lot of the fat from food, and that fat then has to be expelled from the body in an undigested form. And the result is loose stools, which may cause severe diarrhea in some cases. And many people who take Orlistat also suffer from excessive flatulence. There are some natural remedies that you can take, though, some natural substances that can assist you in weight loss. The first come under the category of CLA supplements. Now, CLA stands for conjugated linoleic acid. And despite its rather artificial name, CLA is actually found in many naturally occurring foods, especially meat and dairy products. And it's often recommended for men who want to build muscle mass while losing fat. And they appear to work by converting mass into lean body tissue. But people who take them without making other changes in their diet might be more likely to see results in clothes sizes, but they're not necessarily going to see a drop in weight. And this is because muscle weighs more than fat, even though it has less bulk. So you look thinner even if you stay the same weight. Now, anybody wanting to lose weight can benefit from having a leaner body. It's healthier and it also increases the metabolism, so we're likely to burn more calories. But, of course, most dieters want to reduce their weight too. And the best way to use CLA supplements is to take them at the same time as you follow a healthy eating plan. And that means having a low-fat diet, or a calorie-controlled diet, or, quite frankly, any type of weight loss plan that you can stick to. That way, you're likely to lose weight as well as reducing body fat. So, how much CLA can you take? Well, the best level of supplementation is 3.4 grams of CLA, and there was no increased effect from having more than this. And you can take it as a supplement, or you could just eat more foods that are high in CLA. Interestingly, kangaroo meat may have the highest concentrations of CLA, although whether you could bring yourself to eat Skippy is another matter. There are some side effects. The most common one is stomach upset, followed by diarrhea nausea, and fatigue. Another supplement, another natural supplement that you might want to consider is Garcinia cambogia extract. Now, this is a small tropical fruit that is found in India and Africa, and it's a member of the citrus family. It's too sour to eat, but its rind is used as a spice in Indian cookery. And this is what it looks like in its natural state, growing on the tree. You can see that I suppose it's about the same size as an orange, but it looks a bit like a pumpkin. And you can see it has quite a thick skin, quite a thick rind. Its main active ingredient is hydroxycitric acid, otherwise known as HCA. And HCA gives the same calming effect as food. And some studies have found the weight loss effects of HCA are increased when it's combined with chromium as a supplement. And chromium helps to regulate the body's blood sugar levels. The side effects are that it may lower blood sugar, so it might interfere with diabetes treatments. And the fruit hasn't been adequately studied in pregnant women or women who breastfeed. It may also be a problem for patients with Alzheimer's or other forms of dementia. So, going back to our earlier question, are supplements a good idea when you're trying to lose weight? Well, yes, but only when you use them as part of a wider weight loss program. And it's important to bear in mind that supplements alone won't make you lose weight. You still have to do other things. You can't just simply take a miracle pill and have the weight come off. And if you see anything that makes that promise, I'm afraid it's nothing more than 21st century snake oil.